Hello, my name is Dr. Charles Camisa. I'm a board-certified dermatologist with a specialty in dermatologic immunology. The diseases that I care for the most part, are those which are treated with ultraviolet light and phototherapy. These include psoriasis, vitiligo, eczema, and a rare malignant condition called cutaneous T-cell lymphoma. Well, what is psoriasis? Psoriasis is a genetic disease which leads to an abnormal immune system, and then that abnormal immune response leads to the rapid turnover and growth of skin cells, and that ends up being those thick red scaly plaques that you see on the skin. The treatments for psoriasis range from a simple dry skin cream or cortisone cream or more sophisticated vitamin creams, and range up to phototherapy, which we'll discuss in more detail, and some fairly complex chemotherapy type regimens. The most recent drugs for psoriasis are injectable drugs, and most of these can be injected by the patients themselves or by us or medical personnel in the office. Phototherapy is the use of ultraviolet light therapy in the treatment of skin disease, not only psoriasis, but some others. So when we treat patients with ultraviolet light now in our office, we use mainly narrowband ultraviolet B in a full-body box or cabinet unit. And we also have a laser beam, which is called an eczema laser, which generates another narrowband UVB light that is much more intense and focused. And in those patients, we can target the psoriasis lesions with the laser. Regarding the PUVA, we use PUVA specifically for treatment of psoriasis on the palms and soles, which are some of the most difficult forms of psoriasis in terms of the disability they cause, as you can imagine. Walking becomes difficult, working with the hands becomes difficult, and we can now expose just those specific areas to the chemical in a solution, followed by the UVA, and we'll show you how we do that with a special hand and foot unit. For patients who have vitiligo of the head and neck, which are exposed to the public, that condition can be both physically and psychologically disabling, and we find that the laser treatment gives the best results for those patients.